Ravi, we were talking about how frustrated you were at the back there with the Gordie Howe story. How do you think that the scientific community can correct that problem? I know there were some op-eds that didn't get any traction, and the stories on the efficacy just flow. What do you think?
That's a great question, and I don't know. I mean, I think things like the message that you were giving, science exploitation, is the kind of the message that needs to get out. People need to recognize, because people need to be able to make that differentiation between pseudoscience and real science. And I don't know how that gets out, because it gets so blurred unless you are a consumer of this literature, of the science. And by that I mean, really, frankly, someone who is in the field doing the research, or at least someone who's prescribing it, who should be at least able to determine where they can find legitimate sources. I think it's incredibly hard. And I think it's getting even harder. I'll give you two examples. One I learned about here, and that is that, of course, when we do a trial, we have to register it on clinicaltrials.gov. It never occurred to me that if you had some quote-unquote bogus trial, you should also register it, because that will give you some legitimacy. Wow, it never occurred to me before, but I'm sure that's going on. Another example would be that I've seen this with our own work, where like we had a trial that came out in the latter part of 2014 and got some good exposure and various media things, and then it gets hijacked somehow. Like a month, for about a month, I was getting these emails from India about suggesting that I was going to cure people's diabetes with a monthly injection. I didn't know what it was talking about. I didn't know where this was coming from. It was just weird, patient after patient after patient. And then finally somebody, one of the people writing to me, put a Facebook screen grab, and there was my picture there. And it was all in some language that I didn't recognize. And I still didn't know what this meant, but fortunately for me, it happened to be the language that my parents speak. So I showed it to my dad, and that's how I found out that apparently I'm curing diabetes with a monthly injection. Now, this is a perfect example of legitimate science in real journals, coming from a legitimate institution, somehow getting hijacked out there. And now the real science is, I'm contributing to the pseudoscience.
That happened to me too. The Bakey Institute, they have this rolling quote from experts, and it was a quote from me saying, if people want to access these technologies, why not let them? And I actually did say that, but it's like when they do a movie review and it said, this is fantastic crap, right? And they just took the this is fantastic part. I couldn't believe it. And there I was on being advertised. So yeah, I mean, it's hard. I like the idea of hijacked. It is really difficult when the broader culture hijacks your comments.
I should probably give some context before I speak. So I'm with the Center for Commercialization of Regenerative Medicine, or CCRM, and we are quite unique, not just in Canada, but also in the world. There's only a few translation centers that are doing what we're doing, and that is to bridge the commercialization gap, to move discoveries that are happening in the lab, to turn them into products that can be on the market for you, your parents, people patients. So that is our aim. We are a not-for-profit that is funded by the federal government. We're a center of excellence, and we're very young. We've only been around since 2011. So not to give you the impression that we're going to make this happen in the next couple of years, because I'm very big on managing expectations, because as you've heard today, that's a big problem in our field. But it is our goal to create new companies from stem cell technologies, products, discoveries, or processes to help manufacture stem cells in a more robust way, so that we can scale them up to the quantities that are needed to be of use to patients. And Ravi can talk about that. You would need millions of stem cells to inject into a patient for different treatments. So you need to have a lot of them, and that's one of the things that we're working on at CCRM. So this is a long-term process, and despite the fact that we get funded for a 5-year period at a time, and we're just going back now to the federal government for another 5 years of funding, it means that we are acting quite aggressively to achieve as much as we can in a short period of time. But again, just to be realistic about it, it takes a long time to move products through the clinical trials phases, 10 to 12 years, and creating new startups also takes time and a lot of money. So that's our goal, and we've accomplished a lot in a short period of time, and we have high aspirations that we can do a lot going forward. As the communications person at CCRM, just to get back to the original question, I see a lot of emails coming in through our website because we have an Ask the Expert button and contact us if you want more information. So I get lots of requests from people who are asking about stem cell therapies here in Canada, or where they can go because their father has a certain condition and is looking for a place to be treated. And I do end up referring them to clinicaltrials.gov to look up clinical trials that might be happening in their in the field that the area that they're looking for. And it is heartbreaking because you want to be able to help these people, but the reality is there aren't, those sorts of treatments aren't happening right now in Canada, and I certainly don't encourage them to go abroad and get treatments elsewhere, which is what we're talking about today, stem cell tourism, even though they do sometimes ask about a treatment that they have seen advertised at a specific clinic, usually in the States or a foreign country, not Canadian ones so far, thankfully. And all I can do is refer them to legitimate sources of information and encourage them to think very carefully before they spend their money and take their own health or their loved one's health into possible precarious situation by getting a treatment that could not just make them out of pocket, but also harm them.
So one of the questions that that a lot of people had is where should you send people? What do you guys view as good websites? And I said, there's the ISSCR, there's NIH has one, the Stem Cell Network has one. Where do you recommend that when you have a patient come in, or are you just trying to help people figure out where they should go? Anyone?
All those places you just mentioned.
Okay.
That's where I send them.
It is hard though, right? I mean, to differentiate, and I think it's going to become more difficult in the future, as I was saying, as these trials get closer to the clinic, right? It becomes more difficult to say things emphatically, right? This doesn't work.
Yeah. Eurostemcell is also a good,
that's right.
good website for information for patients.
Yeah, doesn't Eurostemcell, they even have, I think Eurostemcell, which is easy to find, they actually break it down by disease, what's going on in this domain. Yeah. So let me ask, before you get to that question, I'm going to ask another question of the group. Just to be crystal clear for the students, what stem cell therapies are currently available in Canada? Do you think that I was right? It's the bone marrow stuff and the grafting, and that's it.
Yeah.
And the skin grafting is quite limited too. Could someone speak to that?
I don't know much about it, but when they
go for it.
It brings up an interesting point, because there was $500 million spent on developing that technology over 25
the grafting.
years. The grafting,
yeah.
The skin grafting, where they actually make artificial skin. So just to give you an idea of the timeline and the cost, $500 million, 25 years, and it's just now starting to be used, and there's limits to that.
And they're using it, in very limited situations, as I understand it,
Yeah.
Very kind of particular burn situations,
because it's
cetera.
not perfect skin.
Yeah.
And then with the bone marrow, I mean, that works well because they're easy to use cells, and the blood stem cells are very effective at regenerating the immune system. But then it's interesting with patients, because we hear about this all the time, but the actual preparing the patient so their body will take the stem cells actually does a lot of physical damage, because they undergo chemotherapy and radiation.
To ablate the...
the bone marrow. So, and it's also interesting is really someone getting, not to be cynical or negative, but someone getting a bone marrow transplant, if they survive 5 years, that's considered very, very successful. So a lot of times when they talk about successes of stem cells, you have to keep it in perspective. So someone with cancer who's not responding to chemotherapy is going to probably die if they don't have a bone marrow transplant. So if you can do something where they'll live a year or 2 years or 5 years, that is fantastic, but it's not a lifetime. So again,
Yeah,
you have to
I think
keep
that's
that
an
in perspective.
incredible point. You have, manage expectations in a bunch of different ways. I don't know if people saw the news about the new MS treatment. It's not unlike what's going on here with Harry Atkins that was going on in the UK. So this is, and it was portrayed in the popular press, and again, we really watch this as a potential cure. I don't know if you guys saw that, but the aggressive nature of the treatment, this idea that we have to use chemo to destroy the immune system, is incredibly invasive. This is not getting some stem cells injected into your blood vein. This is a very aggressive treatment, and that's often not portrayed in the popular press also.
No. And just again, to follow up on that, if you talk to somebody who's had a bone marrow transplant and has survived and gone into remission, a lot of times they have inner ear problems because the radiation damages inner ear. You can have cognitive problems because you are irradiating the whole body, including the brain. So there are all these side effects that have long-term effects on these patients that no one really talks about. They just talk about the success because that's all people want to hear. They don't want to hear the negative side to it.